reflux, heartburn, GERD, gastroesophageal reflux disease. It's a big problem in our society today. Is it just a matter of too much acid? We're told medically that that's the case. We're told by gastroenterologists you have too much acid. We're going to put you on an acid blocker. The technical term proton pump inhibitors are the most popular. The purple pills, Nexium, Prilosec, Prevacid, that concept. Proton pump inhibitors literally almost exclusively block hydrochloric acid from being produced in the stomach. You have toned down versions of that, the forerunners to the proton pump inhibitors known as H2 or histamine 2 blockers, Zantac, Tagamet, the original, Pepsids, those types of medications. Not quite as powerful. But I guess my real point here today, digestion. Why do you have bloating after meals, heartburn, reflux, distress with digestion? Why do you feel food coming up into your chest? Why do you have pressure in your chest after a meal? Why do you have abdominal bloating? What's the real issue? Is it too much acid, as we are chronically told in the medical community? I want to talk to you about the functional aspects. Is it too much acid? I don't believe that it is. In some of the cases, it may be. There are conditions known as Zollinger-Edison syndromes, where excess or hyper-secretory syndromes, way too much hydrochloric acid. The bulk of Americans don't have that. There are other situations where you don't have Zollinger-Edison, but you are producing too much hydrochloric acid. That's not the bulk of Americans. The bulk of Americans have heartburn, reflux, acid reflux, GERD, however you want to term it, bloating after meals, distension after meals, pain and discomfort post meals, because we do a couple of things badly. Number one, we eat too fast. Number two, we don't chew our food. Number three, we don't eat enough live foods with live enzymes in it that actually aid in the digestive process. We consume too many carbohydrates, and we consume too many refined carbohydrates. We've got to consume carbohydrates that have more fiber in them. We've got to consume more carbohydrates that are unprocessed, breads like Ezekiel bread. So I don't eat the right foods. I eat too fast. Why? Digestion begins in the mouth. Mastication begins the digestive process. I must chew my food. If I don't chew my food, there's no way that I can expect my pancreatic enzymes and my hydrochloric acid that's being produced in the parietal cells in the stomach to do the work of digestion, and bile as well. So let's look at it again. Do I eat too fast? Do you eat too fast? Do you eat too many foods that can trigger heartburn and reflux? Caffeine, tomatoes, chocolate, things that lower, foods that lower the esophageal sphincter tone, the tone of that muscle that helps to keep the hatch closed. So I can eat a lot of foods that are triggers. I can eat too fast. I can not chew my food. I can eat foods that contain very little in the way of live enzymes. I can then not consume enough quality proteins. And that leads to a big problem. Quality proteins that you consume, fish, chicken, eggs, and so on, are then broken down into amino acids. These amino acids are then utilized by your pancreas to do the work of digestion at a subsequent meal, a subsequent day, its future. So what you take in the way of quality proteins today, cleave them, separate them, are then taken up in part, all bodily parts, but are taken up by the pancreas. These amino acids now become the building blocks for amylase that breaks down carbohydrates, protease that breaks down proteins, lipase that breaks down fats. So the protein I consume today, as I break it, as I cleave it, as I literally cut it into slivers, digest it, take it into my circulatory system, I then use that to do the work of digestion at my next meal or tomorrow's meal. I mentioned live enzymes. We eat a lot of processed foods. We eat very, very little in the way of foods that are live and real foods. Apples, peaches, pears, grapes, spinach salads. We've got to eat more of these live foods. Next, the imbalance of good and bad bacteria. If you have a lot of bad bacteria growing in your intestinal tract, where you have some fungal or yeast overgrowth, we all have some, but if you have an overgrowth, that'll disrupt your digestion. If you eat under a highly stressed state, if I'm too stressed, major impairment to your digestive juices. When I'm under stress, the process of digestion gets put on the back burner. If you're usually stressed, you need to take a few minutes, you need to pray, you need to read your Bible, you need to deep breathe, you need to decompress before you sit down and eat a large meal. Lastly, the poor function of hydrochloric acid. I'm using acid blockers for heartburn, reflux, GERD, and yet in many cases you still may be having symptoms. Blocking the acid is not necessarily the answer. See, we've been told for years that if we don't take these acid blockers, we're going to develop esophageal cancer. Now, if you're a medical professional and you're listening to this, you're going to want to string me up. But here's the facts. The facts, if you look at the literature from the mid-80s on, we have a skyrocketing incidence and case on a yearly basis of rising rates of esophageal cancers. Esophageal cancer is at an all-time high. But I've been taking acid blockers. Oh, not everybody has. Unfortunately, that class of medications is probably one of the most widely prescribed medications and class of medications on the market. We're using more acid blockers. Prior to 1985, this didn't exist. Histamine 2 blockers, Tagamet, did not exist, whatever the year was, 83 or 85. Since then, we've had H2 blocker after H2 blocker. We've had proton pump inhibitor, purple pill after purple pill, Acifex, Nexium, the whole gamut. We're using more of these drugs than we ever have, yet esophageal cancer risk and esophageal cancer rate, continues to rise. I thought blocking the acid was the answer. I don't believe that it is. What we're finding now is by blocking the acid, we're actually not neutralizing pancreatic enzymes. So pancreatic enzymes that are coming back up onto the esophagus may be more dangerous than, quote, the perceived hydrochloric acid. I'm a big believer that we shouldn't disrupt unless we have no choice. You have Barrett's esophagitis, etc., or Zollinger-Edison syndrome. You have no choice. In other cases, most folks, of all the reasons that I gave you, we don't eat well, we eat too fast, we eat a ton of fast food, we eat a ton of the incorrect foods, we drink a ton of caffeine, eat a ton of chocolate. We do things that disrupt the normal digestive process. Digestive enzymes. We use superzymes, ultra-vegizymes. These are key components to help you digest. We'll use probiotics, essentials, probiotic essentials, 12 billion units with a lot of upper digestive types of good bacteria to facilitate the digestive process. Folks, blocking acid in the stomach is not always the answer. If you have digestive discomfort and problems, tips for digestion. I use a little sheet talking about tips for digestion. It centers around drinking your fluids predominantly away from your meals, small amount of fluid with meals. Drinking warm fluids, maybe something like tea or green tea before the meal. Stimulate your digestive processes. Make sure that you chew your food well. We've gone over the basics. We use digestive enzymes, either ultra-vegizymes or superzymes, to aid the digestive process. Now, if you're using an acid blocker, I would not recommend that you stop something like that cold turkey. You should do that under supervision. You have to wean away from these products as you enhance the process of digestion, as you improve the functional aspects of digestion, all the things that we've covered. Let me cover with you for a moment some of the downsides, some of the negative aspects of using acid blockers long term. I'm just going to give you a few. We know right now that there's higher rates of bone fracture in folks that use acid blockers long term. Why? Because it impairs mineral absorption. We know that there are lowered levels of B12 for folks that consume acid blockers. That's a huge problem for the elderly, by the way, and neurologic function and dementia, focus and attention, etc. We know that pneumonia risks are higher in folks that use acid blocking agents. We know that the occurrence of a serious bacterial infection known as Clostridia difficile is much higher in patients that use acid blockers. Number two, they respond less efficiently to the treatments, the traditional medical modalities to deal with C. diff. Number three, the rate of recurrence. This is a hideous, hideous intestinal manifestation, by the way. 13, 14, 15 vicious, violent bowel movements a day, bloody stool, violent disruption, can be life-threatening in some individuals because of electrolyte mineral depletions. So folks, if we're using this class of medications, the potential for B12 status to go down, poor mineral absorption, hypomagnesia is documented in the literature. It's right on the FDA's website. You can look it up yourself. Higher pneumonia risk, higher C. diff infection rates, poor response to medications, higher recurrence rate. It's about threefold higher, the recurrence rate, in a population that uses acid blockers versus a population that does not. If you want to enhance your digestion, stay tuned for part 2, and we'll go over the ABCs of how you can enhance your digestive process. God bless you. Thanks for tuning in. See you next time.